and we will get started. Thank you all for joining us. Thank you all for joining us today. We will get started in just a few moments and allow everyone a chance to log in. While you're waiting, there is interpretation available in Spanish and Portuguese. You can find the interpretation through the globe at the bottom of your Zoom window. There's a globe that says interpretation. You can select the language that you would like to listen in. We'll just give everyone a few more moments to log in. It looks like we've still got a good number of people coming in. Interpretation is available in English and Spanish and Portuguese. Thank you all for joining us today. I will now turn it over to ASH Executive Director, Laurent Hubert.
Thank you, Megan. And welcome to everyone to this webinar on the alignment and complementarity between the environmental treaties and the WHO Framework Convention on Tobacco Control. We have a very diverse audience today, so interpretation is available, English, Spanish, and English, Portuguese. And so just please use the icon at the bottom of the screen with the globe to choose the language of your choice. Tenemos interpretación simultánea. Por favor, utilice el icono del mundo en la parte baja de la pantalla para escoger el idioma de su préférence. Malheureusement, je sais qu'on a une audience francophone. Malheureusement, nous n'avons pas d'interprétation simultanée en français. Cependant, si vous n'êtes pas capable de suivre en anglais ou en espagnol, envoyez-nous un message à info@h.org et on peut essayer d'arranger une autre séance plus tard pour les participants francophones. So I want to take this opportunity to thank the co-hosts of this webinar, Action on Smoking and Health, the Center for International Environmental Law, the Global Center for Good Governance in Tobacco Control, the Stop Tobacco Pollution Alliance, and the WHO FCTC Article 17 and 18 Knowledge Hubs. So thank you for helping organize this webinar, and thank you to all of you for joining us today. And this is the first of a series of webinars that we will do that shows the complementarity and the synergy between UN treaties and the WHO Framework Convention on Tobacco Control. And today we have a fantastic lineup of speakers who will make that case that there's a tremendous amount of complementarity and synergy between the FCTC and UN environmental treaties and processes. And they will propose opportunities for collaboration and cooperation. And particularly around the conference, the work that we can do linking the conference of the parties of the WHO Framework Convention on Tobacco Control and the ongoing treaties for the UN Treaty to End Plastic Pollution. And you will hear more also about what's happening around Article 18 of the FCTC, which is the article that addresses protection of the environment. We're very fortunate to have that article in the treaty, but it's been one of the most one of the least implemented articles in the FCTC. So if you have questions during the session, feel free to type them using the Q&A box, and I will address them later during the Q&A session, and feel free to address them to a specific panelist if that is useful. So I will welcome the first panelist who will give us some words, some opening remarks. And the first panelist is Dr. Adriana Blanco Marquizo, and she's the head of the WHO Framework Convention on Tobacco Control Secretariat based in Geneva. Adriana, the floor is yours.
Gracias, Laurent. Viendo que tengo la oportunidad de hablar en español, voy a tomar esta opción, porque siempre es más fácil para el cerebro hablar en su propio idioma. Bueno, un gusto realmente de tener la oportunidad de hacer estos pequeños comentarios y de ver cómo estamos uniéndonos desde la comunidad de control de tabaco y la comunidad de medio ambiente, porque tenemos muchas tareas en común. el hecho de ver otro grupo poniéndose junto para crear un nuevo tratado, una nueva obligación vinculante para los países, es muy interesante y ver cómo este tratado se relaciona con el convenio marco de la OMS para el control de tabaco es muy importante y creo que hay mucho trabajo para hacer juntos. Creo que nos podemos ayudar y que un área va a fortalecer mucho más el trabajo en la otra. Sabemos que lo que llama más la atención, obviamente, en el tema de control de tabaco es el tema sanitario, es el número de muertes que se producen al año con más de 8 millones, 8,7 millones de personas al año en todo el mundo muriendo por esto y quizás una cosa que es muy importante es más de 1 millón de personas muriendo por culpa de, el humo ajeno y no por su propia decisión de fumar. Pero el tema del impacto que el tabaco tiene en otras áreas, como por ejemplo la economía y el medio ambiente más que todo, creo que es realmente la cenicienta de las consecuencias del tabaco, es lo que la gente menos conoce y realmente no aprecia, es que realmente el tabaco desde su inicio hasta su disposición cuando se tira la colilla, es realmente dañino para la salud de la persona que trabaja en el cultivo, para la tierra, para los mares, para todo el medio ambiente. Entonces, es realmente interesante y esto no es la primera vez que hay un interés en la comunidad de control de tabaco en relación al medio ambiente, porque ya en la COP8, en el 2018, hubo una parte del segmento de alto nivel que estuvo dedicado justamente al tema de control de tabaco y acciones en el tema del cambio climático. Y este año en la nueva COP, que bueno, como Lorán dijo, empieza la semana que viene, bueno, la siguiente semana, el 5 de febrero, también va a haber un evento paralelo donde va a estar también el Centro de Conocimiento de Brasil en artículo 18, que ha hecho mucho trabajo en relación a este tema. Nosotros hemos tratado desde la Secretaría de colaborar con este tema, hemos apoyado a la OMS cuando los días mundiales sin tabaco tuvieron relación con este tema, como hubo uno en relación a los efectos dañinos del tabaco en el ambiente y otro relacionado con tabaco y seguridad alimentaria. Un tema que es muy importante porque aquí hay otra línea de trabajo que también es muy relevante en este momento, donde a consecuencia de la situación geopolítica y de los problemas ambientales, la seguridad alimentaria cada vez está más amenazada y que realmente mucha tierra productiva se está utilizando para producir algo que realmente no solo no le produce ningún beneficio a la humanidad, ni tampoco al medio ambiente. Hemos participado en algunas de las COP de Basel, Rotterdam y Estocolmo, en esas convenciones de medio ambiente y también en las COPs del convenio marco para el cambio climático. Recientemente la Secretaría preparó un toolkit sobre el artículo 17 para tratar de ayudar a los países que cultivan tabaco para que encuentren cultivos alternativos, que le den un mejor medio de vida a los cultivadores y que también respeten el medio ambiente. En el año 2022, ustedes recordarán que UNEP presentó una campaña llamada Clean Seas en inglés, pero a océanos limpios, para tratar de llamar la atención sobre todo el problema de los microplásticos en los mares y uno de los colaboradores con ese problema son los filtros de los cigarrillos. Y creo que va a ser muy interesante y tienen expertos que van a darles una muy buena visión de cuál es el problema de los filtros que todos sabemos que en realidad no tienen ninguna función desde el punto de vista sanitario y crean un problema ambiental. O sea que, por suerte, países en distintas regiones del mundo están pensando a considerar el hecho de tomar acción contra estos plásticos, que son plásticos de un único uso y que realmente no tienen la finalidad que la industria quiere hacer creer, que es proteger la salud de las personas cuando sabemos que no hay forma de proteger la salud cuando se consumen productos de tabaco. Hemos también estado acompañando desde la Secretaría las negociaciones. Hay un colega que específicamente se ha dedicado a seguir el tema el medio ambiente y ha estado colaborando en los comités intergubernamentales de negociación y esperamos que sea posible seguir en esta línea en el próximo año. Como decía al principio, creo que el hecho de trabajar juntos con distintos sectores y con la sociedad civil en su totalidad, no solamente la sociedad civil que trabaja en control de tabaco, pero también la sociedad civil que trabaja en el tema de medio ambiente, nos puede dar una retroalimentación que va a ser favorable para ambos grupos. Y creo que este es un buen camino para seguir. Realmente todos vivimos en el mismo planeta y probablemente no tengamos un hábitat por mucho tiempo si no tomamos algún tipo de acción. Con esto no quiero tomarles más tiempo y me voy a disculpar que los voy a tener que abandonar. Como saben, la COP está muy cerca. Eso me pone un poco nerviosa y como imaginarán, tengo unas cuantas cosas que hacer en estos días. Así que les deseo la mejor de las suertes. Es un gusto ver a tan buenos colegas que van a estar acá charlando con ustedes y espero que sea muy disfrutable este webinar. Gracias, Lorán, y gracias, Ash, por la invitación.
Muchas gracias, Adriana, y desde luego esta cooperación es tan importante entre el Convenio Marco y todos los tratados internacionales y es parte también de este trabajo que está pasando en la ONU en este momento, en la cual se está promoviendo cooperación y coordinación entre tratados internacionales. Es sumamente importante que no solamente se respete, pero se reconozca el impacto que puede tener el Convenio Marco sobre no solamente objetivos de salud, pero objetivos de medio ambiente, objetivos de desarrollo y objetivos de derechos humanos. Es realmente una herramienta que tenemos a nivel internacional y tenemos que maximizarlas. Muchas gracias, Adriana, y toda la suerte para la próxima COP. We will now switch to the next panelist, who's basically one of the key leading experts on the environmental impacts of tobacco. And this is Dr. Thomas Novotny, Professor Emeritus at San Diego State University School of Public Health, and he will discuss the environmental impact of tobacco through its entire life cycle. Tom, the floor is yours.
I'm going to shift to my slides here very shortly and share those with everyone. And it's good morning for me here in Mexico. I'm on a bit of a holiday. And just to remind us that public health is extremely important in all things. Yesterday, I got my second case of COVID. So I'm speaking to you today under the influence of medication, and hopefully it'll turn out as well as my last episode of COVID. But nevertheless, the public health problem that has never left us since 1492, I think, and probably is going to be with us for decades into the future unless we can do some strong actions, not just on our approaches through public health, but our approaches through the environment, which is what we need to be talking about more and more today. And I've been working on this issue as an environmental component of tobacco control for at least a decade now. And it's clear that the environmental issues have a significant part to play, not just in terms of their adverse effects on the environment, which I'll briefly go over today, but also because this presents another opportunity to partner with agencies, individuals, advocates from across the environmental advocacy community. And this is particularly important right now because there is a treaty going on, as I think you all know now, negotiating to do something about the plastic pollution that is just envelops our country. And here again, I'm in Mexico, walk along the beach here the last several days. What do I see? Plastic. And what do I also note? That much of this is the plastic filter that comes from cigarettes. And so we know that we've got a problem that's linked to the plastic environmental concern that we should try to join then along with some rather substantial international movements to address this issue. Now, I do want to emphasize and start as Lauren mentioned, that tobacco, aside from being a full-service health hazard, it's a very extensive life cycle hazard to environmental pollution. And this starts with tobacco growing. And I think most of us know that tobacco growing It's in actually 120 countries, believe it or not, that it is hard on soils. It requires pesticides. It also requires a rather unholy alliance between the growers, who are almost all small farmers, and the tobacco industry, which sets the prices and sets the requirements for various pesticides and agricultural supports, such that these continued sort of dependency between the farmers and the tobacco product producers is really a setup for failure for the small farmers. It's a setup for large profits for the tobacco industry. The cigarette production process is actually a dirty process. Everything from being unregulated in many of the places now where production has been moved from developed countries to developing countries, but also because the process, for instance, when it attempts to reduce the nicotine content in cigarettes, that produces chemicals, many of which are on what are called a toxic inventory that the United States EPA, Environmental Protection Agency, has designated as hazardous chemicals as a result of production. Transportation goes to it's easy to understand that this global market of tobacco production, exportation, causes carbon impacts on the transportation and distribution process. Cigarette consumption is an environmental issue. The second leading cause of lung cancer, second only to cigarette smoking, is environmental tobacco smoke. That's the smoke that's inhaled from the tip of the cigarette or from the exhaled breathing of cigarette smoke from the smokers. That is carcinogenic. And so we know that secondhand smoke is an environmental hazard, but we all know now about thirdhand smoke, which is actually sort of a form of tobacco product waste, where the residuals of cigarette smoking basically are attached to indoor environments, even outdoor environments perhaps as well, but making indoor environments actually that are exposed to cigarette smoking quite hazardous. We've done a number of studies now, children especially who have indiscriminate eating patterns and are exposed on floors or other surfaces, in particular, are exposed to nicotine and other chemicals as indoor smoking, even when the smoking has been discontinued for decades before. It just doesn't go away. And then the last and one that I'll mention more, emphasize most for the rest of my talk, is cigarette butt waste. And this is not just, of course, cigarettes. There's other kinds of waste, packaging, e-cigarette waste, pipes, you name it, whatever the tobacco product is, these are often tossed irresponsibly into the environment, where many of them do not biodegrade. Tobacco does, it's an organic product, but the filter, which is found on 99% of commercial cigarettes, is plastic, and that's the thing that we need to focus on quite more in the coming months, especially with the plastics treaty. Cigarette butts are the #1 littered item found on beaches and waterways. That alone, I think, is probably evident to almost everybody who goes to the beach, who looks down on the streets in urban environments. There's 30% of all the beach litter that's cleaned up, and this happens over and over and over for the last 30 or 40 years on international coastal cleanups. It's not that much, though, when you think about it. It's about 1 million butts that are picked up on the international coastal cleanup. Now, certainly more groups pick up butts throughout the year, but that just gives you a taste. It's an alert. It's not a cleanup. It's not a success. It's a warning rather than an intervention. 10 to 20% of all observed small urban litter are cigarette butts. Well, how much is that? Well, we know this number changes, and we're probably down a bit more from 5.6 trillion cigarettes sold per year. If when you think about that number, you can go from here to the moon and back again a number of times if you put 5.6 trillion cigarettes end to end. We don't know exactly how many there are, but from various studies, between 20 and 65% are discarded somewhere inappropriately. Now, that doesn't mean that they're not discarded appropriately. They could be discarded in cans and sent into landfills. But let's say these are the ones that are just dumped on the streets or dumped into the environment, end up as trash, just as they do on the international coastal cleanups. Again, almost all of them are filtered with cellulose acetate, which is a persistent plastic waste product. 20 cigarettes weigh 3.4 grams. And if you just multiply that out, that's 765,000 metric tons of weight of cigarette butts each year in the environment. And that is based on the 4.5 trillion butts discarded. So let's go at the top end. This doesn't include all the other things that I mentioned in terms of smokeless tobacco, e-cigarettes, etc. Well, what happens with these filters? They are in health, I think, in general, a health and environmental hazard. Let's look at the plastics. Again, besides just the weight, each filter releases these plastics as microfibers, up to 100 microfibers per day. We know that the specific cellulose acetate filter is found in urban runoffs. We know that cigarette butt leachates, that is when you soak a cigarette butts or several butts in water, this becomes a toxic waste product or toxic hazard to all sorts of living creatures. We know that it can change microbial communities in the natural environment. We know that it contaminates pristine environments that should have been free of cigarette use or exposure. And whether or not the microplastics actually get into humans and cause damages, this is still under investigation. I read just yesterday, however, that one exploration that's going on is in Parkinson's disease, because the microplastics may have been implicated in the aggregation of the alpha-synuclein, which is the protein that aggregates in those with Parkinson's disease. That'll be an interesting finding. Human and animal health impacts are known. Again, I mentioned all the ones from laboratory, but also even in the field, even in natural environments, humans, actually, even small children, have consumed cigarette butts and become toxically impacted by them. We know that there are some sublethal effects besides just killing creatures that are exposed to them. We know that there can be estrogenicity, tumorigenicity, and that they may be able to bioaccumulate in the food chain, especially when we look at organisms that could potentially be part of the food chain, like rainbow trout. The laboratory studies indicate that these organisms do, in fact, bioaccumulate, which means, again, if they are consumed by higher level organisms, they'll enter the food chain. There's cost to tobacco product waste. We are now working on a project to do a careful analysis and develop a model. And just briefly, I think you can all imagine these costs. What are the costs that are incurred when you try to prevent or pick up cigarette butts? Prevention costs means signage. There's no smoking signs, or there may be interventions to invoke the law to keep people from dumping their butts, but this is very seldom done. Surface abatement, which is what we probably know most about. Street sweeping, either manually or with the machines, that picks up the litter, but that doesn't collect all of the litter that's out there. Not all of the butts are going to be picked up. They're going to be hidden in the bushes, etc. System abatement is something where the storm drains and other kinds of filtration mechanisms take care of wastewater that will, in fact, contain cigarette butts. Saw one study that said that in an urban environment, 8% of the material collected by weight was actually, no, by count, sorry, was cigarette butts in storm drains, 8%. So that's something that many cities have to deal with, especially those who are trying to prevent microplastics from going into their aquatic environments. Disposal, there are costs to disposal, whether it's the cans, trash cans that are on the street that have to be emptied and maintained or provided, or disposal in landfills, which may also be a source of leakage of the tobacco product chemicals. And then there's the unabated litter and waste, the stuff that we don't know about, the stuff that we can't pick up, the stuff that's out there, the stuff that is broken up into small microplastics. What is it doing to the environment? All of these have costs. Well, the filter, just to summarize, and I'll close very shortly, the main purpose of this cigarette filter is to sell cigarettes. It's cheaper actually to even attach a cigarette to a cigarette filter to a cigarette than it is to make that part of the cigarette tobacco. It's cheaper to have that piece of plastic. But the main thing is there's been an implication that filter, the word filter, implies a safer cigarette. What we do know now that whole implication of safe cigarettes, low tar, low filter, is fraudulent. the filter is really the culprit here, where it makes it easier to inhale, where it makes it less likely that people are going to have a harsh flavor during smoking, and it makes it easier to sell cigarettes. That's for sure. So why do we want that if what we're trying to do is get people to quit smoking, and if it has absolutely no health benefits? And that, I think, is the important thing to emphasize, that the filter is plastic. It sells cigarettes. It's a fraud. It does not improve the health of smokers. We have data now that convinces that the adenocarcinoma, which is a more aggressive kind of lung cancer, is a direct result of the advent of the filter over the last 30 to 40, 50, 60 years. That kind of cancer, lung cancer caused by cigarettes, has become much more common. We know that the cigarette encourages people to smoke. That's an adverse effect. We know that it probably discourages people from quitting because it's a filter. That we know is an adverse health effect. And now we know that there are plastic impacts of the filter in the environment, and that makes it a hazard to human health as well. So I'll just mention briefly e-cigarettes. These are more common among young people now being smoked. And there are types of e-cigarettes that are disposable, single use. There are also these pods, which are shown on the right here, from Juul and other cigarettes, which are tossed in the environment because there's no other instruction on the package to do with them. And these contain nicotine, which is a toxic hazardous waste product, as well as plastics, as well as if a whole e-cigarette is tossed in the environment, the lithium ion and other metals that can contaminate the environment, that makes them a hazardous waste product as well. So I'll conclude by providing there's a few references here. Our California Tobacco Control Program did a big white paper on TPW. You can get it on the link. It's free. I wrote an article in May that really tries to just say, look, the filter is a human health hazard, and that it should be banned. It is possible that even local jurisdictions can implement a ban on the sale of filtered cigarettes, but this is something that could be done by this treaty at a global level. There is an article here also from the WHO that talks about the life cycle throughout in much more detail than I've been able to cover here today. So I want to thank you for your attention and turn it back over to Laurent.
Thank you so much, Tom, and for describing so well this particularly around cigarette filters and that negative impact it has. But I think also during the presentation, during the discussion later, we'll hear more also about some other environmental impacts associated with tobacco production, such as, for example, even the impact on deforestation. For example, it's supposed to be responsible for up to 5% of global deforestation, or more than 80 tons of CO2 emissions. So it's really, really a significant. Right. That can be addressed not only through the FCTC, but through environmental treaties. And our next speaker is Kritika Khanijo, and she will update it a little bit about the WHO's engagement in the plastic treaty and some of the environmental treaties. As WHO has been pointed out earlier, released an amazing report 2 years ago, really exposing the environmental impact on tobacco through its entire life chain, which is really, really not insignificant. It's quite an impact, and if we're able to address that as a global community, at least it will make a tremendous advances in environmental health. Kritika, the floor is yours.
Thank you, Laurent, for the introduction and the kind invitation to join this webinar. And thank you also to Tom for highlighting the environmental impact of tobacco products throughout the life cycle of the product. And as mentioned by you, the World No Tobacco Day in 2022 highlighted that tobacco is not just poisoning people, but poisoning our planet as well. And the poster from that campaign is what I have with me on the screen right now. So as mentioned, WHO, along with our colleagues from the Secretariat of the WHO FCTC, has been participating in the Intergovernmental Negotiating Committee, or the INC, negotiations of the plastic treaty as an observer. As the mandate of the INC intersects with many areas of WHO's work, but I will limit my remarks today to tobacco control. On this slide, I have a timeline of events to provide you with a brief snapshot. So just before the World No Tobacco Day, in March 2022, the United Nations Environment Assembly adopted a resolution, which is the Resolution 514, to negotiate an international legally binding instrument to end plastic pollution, including in the marine environment. The resolution notes with concern that the high and rapidly increasing levels of plastic pollution represent a serious environmental problem at a global level, negatively impacting the environmental, social, and economic dimensions of sustainable development, which include related risks to human health and adverse impacts on human well-being. Now, at INC1 in Punta del Este, which was really the session in which member states expressed their ambitions for the treaty, widespread support was observed for a treaty objective of ending plastic pollution to protect the environment and human health. And then at the second session in Paris, during which member states discussed a document on what elements should be included in the treaty, WHO urged states to create binding legal obligations under the treaty to ban, phase out, or reduce problematic and avoidable plastics, including cigarette filters. Now, before going into the third session in Nairobi, wherein states were going to discuss a zero draft of the treaty, WHO made a submission sharing information from the 2022 report, along with referencing work carried out by Tom and others to highlight that cigarette filters are the most littered item in the world and do not have any proven health benefits. WHO supported an immediate ban of plastics in nicotine and tobacco products. And where an immediate ban was not feasible, a gradual phase out or stringent control of plastics present in tobacco products, electronic nicotine delivery systems, and packaging, again recognizing them as problematic and avoidable plastics under the treaty. I'm happy to share that in addition to Panama, which is hosting COP10, Palau and Mexico endorsed this position in Nairobi. And hopefully we can utilize the upcoming COP in Panama to call upon more member states to be engaged in the work of the INC and to address tobacco product waste as we move into the more substantial negotiating session of the Plastics Treaty in Ottawa, Canada. Through all the sessions, WHO underscored the importance of transparency and management of potential conflicts of interest with public health or environmental objectives in the development and implementation of the treaty. Now, one may ask what are the opportunities present before us? And I've outlined three for the consideration of our audience. Now, as I mentioned, to garner support of member states to advocate for the inclusion of cigarette filters and disposable electronic cigarettes in the annex of problematic and avoidable plastic products. What are going to be the criteria for this classification is still to be seen and at INC4 and haven't been decided in any of the prior sessions. The second would be extended producer responsibility. Now, it's, again, given the stage of negotiations of the plastic treaty, it's uncertain how these provisions will shape in the text of the treaty, but to advocate that in the phase-out phase of cigarette filters, EPR schemes be used to hold the tobacco industry accountable for tobacco product waste, be it collection or disposal of these products. And we have examples from France and Spain on how manufacturers and marketers of these products can take financial responsibility for the management of tobacco product waste. However, a word of caution is it is important to ensure that a measure like this is compliant with bans on direct and indirect forms of tobacco advertising and promotion, simply because such measures should not be used by the tobacco industry to position themselves as a sustainable enterprise of sorts. And third, are lessons from tobacco control with respect to managing conflicts of interest are a great example for the Plastics Treaty to ensure the importance of transparency in the development and implementation of the treaty. Albeit though in the context of the Plastics Treaty, the industry becomes more heterogeneous, but there are still synergies and an alignment from the WHO FCTC. On the next slide, I've shared some resources, and I'm conscious of my time here, so I'll stop. But I've also included my email address in case there are any member states that are attending this webinar and would like to get in touch to learn more about the plastic treaty negotiations, the revised draft that is being considered in Ottawa, and just what else can WHO do and how we can support you. Please do get in touch on that. Thank you.
Thank you so much, Kritika. Thank you for bringing up such important points, like, for example, the conflict of interest one. And I think it's worth pointing out that even at INC 1, Volker Turk, the High Commissioner for Human Rights, pointed out to the INC for the Plastic Treaty that the clear boundaries and conflict of interests are needed, and really framed and presented the FCTC as a best practice example that countries should use when developing the plastic treaty. And also, thanks for bringing up the issue of them. How do we ensure that cigarette filters make it to the list of problematic plastics? I remember some of the early lists that came up. The early criteria that we developed ahead of INC 1 suggest that a lot of the toxic, likelihood to be discarded, etc., that suggest that the cigarette filter should really fit in that category. And also for bringing up, as Tom pointed out, also the tendency by the industry to use environmental platforms and the extended producer responsibility mechanisms, trying to use them to their advantage to then greenwash themselves. So that's a recurring theme I think we're going to see time and again. I want now to invite our next speaker, Dr. Vera Luiza da Costa Silva, who is the Executive Secretary of CONICQ, the National Commission for the Implementation of the Framework Convention for Tobacco Control in Brazil, but has a tremendous amount of expertise with the FCTC. It's been his head, was also head of the Secretariat for a number of years, and was developing in the treaty negotiations when the FCTC was being negotiated itself. Vera, the floor is yours.
Thank you very much. Good morning, good afternoon to all, and very pleased to participate in this discussion. Thank you for the invitation. And just let me also greet Adriana in Geneva, and especially Adalberto Felicio Filho, who is Adalberto Maluf Filho, who is the Secretary in the Brazilian Environmental and Climate Change Ministry. So I am very pleased to join this discussion, and I think that in fact I will try just to address a little bit the more practical aspects on. So we have a sort of a bulk of evidences. We have a number of aspects that were highlighted by Tom and then by Kritika in terms of what is the problem and what are the potential opportunities for the discussion on Article 18. And I will not spend lots of time with it, but basically, overall, tobacco production and consumption chain pollute the environment from cradle to grave, moving it from being a human problem to a planetary problem. And we have already heard from our speakers the number of aspects, but I think that we have always an underlying problem, that is that tobacco kills 8 million people every year. And this by itself is sufficient for us to try to find out how to address this in all the several aspects of tobacco control. The Knowledge Hub on Article 17 and 18 at Fiocruz has prepared some infographics about the impacts of Article 18 in not only in the environment itself, but also in all the tobacco production cycle. And I invite you to visit their webpage and to look into this. I will not also concentrate my speech here. But basically, we have a number in Brazil that it is estimated that around 202 million US dollars per year are used to clean waste generated after consumption of tobacco products, such as cigarette butts. And the costs fall on taxpayers and not on the industry. Moreover, the industry nowadays is using corporate social responsibility strategies to make themselves to greenwash, to make themselves as a partner in these discussions. And the bottom line is that we have a treaty, that's the Framework Convention on Tobacco Control. We have an Article 18 where parties just have an obligation to have due regard to the protection of the environment and the health of persons in relation to the environment. And we have the policy options and recommendation on Article 17 and 18. But time has gone, and we have new studies, market changes, increasingly raising the attention regarding additional aspects of environment impact of tobacco that are not linked to tobacco growing and that concerns not only tobacco producing countries. And that's why Brazil has proposed for COP10 in Panama an agenda item and also a draft decision. And this agenda item has come as an supplementary agenda item that has to be adopted by COP10. Once adopted, or even if it's not adopted, but in any case, Brazil has proposed the draft decision. We have now two co-sponsors, Panama and Ecuador, who have joined the draft decision. And we are receiving lots of suggestions and comments from governments. And the proposal of the draft decision is exactly to make strong links with the 2030 agenda, with the Intergovernmental Negotiation Committee, the INC of the Plastic Pollution Treaty, and the United Nations Climate Change Conferences. And Brazil has been a very central part in these discussions because Brazil has a high profile in terms of protection of environment. There will be a COP organized by Brazil in Belém do Pará. And Brazil has also a very strong position in regard to the plastic treaty. The main aspects of the proposal from Brazil is to highlight the importance of the environmental impacts separated from Article 17 from the point of view that the Article 18 has its own life, its own way of being implementing, especially because a number of countries do not grow tobacco, do not have this impact on tobacco growing and production, but have on consumption and disposal and sort of the other 50% of the tobacco life cycle. So inviting parties as well to look into Article 19 and liability of the tobacco industry. The tobacco industry is being promoting everywhere that the consumers are responsible for the disposal of butts, of the components of e-cigarettes, whatever. But in fact, the tobacco industry is the very much responsible for this problem. And the idea is that at COP So here a little bit more aspects. The idea is that COP has a decision on Article 18 that promotes the discussion, promotes new compilations and study and reviews, and that in COP 11 we can eventually advance in terms of regulating cigarette butts. We know that they are not useful at all from the public health perspective. And having said that, I think that let's give very much the credit to Tom Novotny, who is here, and to WHO, who has also promoted this as a concept. I have participated with Tom in an article that was probably one of the first ones in terms of the environmental impact of tobacco, and we have been working and promoting the discussion on this topic. So thank you, Ash. Thank you all the colleagues from all the different areas. And thank to Brazil government for bringing this forward at COP10. And I think that there is lots of positive responses, and I am sure that we are going to get a very good decision at COP10. Thank you very much.
Thank you, Vera, and thank you for bringing up such important points that the important need to separate those two treaties, those two articles in the treaty. And for those of you who are not that familiar with the FCTC, Article 17 deals with alternative livelihoods, and 18 is the environment article. And those two had been combined. And Vera has been a leader in trying now to make sure that Article 18, the environmental impact of tobacco, is addressed on its own. And that's why we have, thanks to her leadership and the leadership of Brazil, this fantastic decision that's being presented and fully supported by civil society. And so, again, and congratulating Brazil also. It's a great pleasure to have in this webinar Mr. Adalberto Felicio Maluf Filho, who's the National Secretary for Urban Environment and Environment Quality of Brazil, and will share his perspective as an environmental ministry high-level person. Mr. Felicio Maluf Filho, the floor is yours.
Okay, thank you very much, Laurent. I would like to say hello to everybody, especially in the name of my colleague, my friend Vera, so that we can follow up today. Well, since President Lula was elected, Brazil is improving dramatically its integration between agriculture and environment. As you might know, our Safra plan and the plan for agriculture, almost more than $70 billion, and also our agriculture plan for family agriculture, also 22 billion. For the first time, is really moving on a low agriculture, low carbon agriculture. And we were able to reduce deforestation 50% in the Amazon, 17% in protected areas. So slowly things are moving on. However, we all know that the production of tobacco has been causing a lot of environmental impact, affecting ecosystems, natural resources, contributing somehow to biodiversity loss, ecosystem fragmentation, change in natural cycle. Even the drying or curing process of the tobacco leaves, they release volatile organic components, fine particles, other atmospheric pollutants, also contributing to air pollution and negative impact on respiratory health. Moreover, the intensive use of pesticides in the tobacco cultivation somehow can be contaminating our soil and water, negatively impacting fauna, flora, posing risks to the human health. And this agricultural practice sometimes can lead to soil erosion, hill slopes, soil degradation, nutrient loss, among many other things. So faced with this challenge, there's a growing concern among people here at the government, policymakers, civil society, and also the population awareness that we need to adopt more sustainable practice in the tobacco production here in Brazil. So this includes, of course, organic methods, reducing pesticides, and more importantly, also supporting viable alternatives for tobacco farmers. Brazil is one of the world's largest producer and exporter of tobacco leaf. So tobacco farming occurs in small family-owned properties, mainly in municipalities in the south, where we have some of the richest areas of Brazil. They estimate something around 130,000 families that are regulated by integration on this contract, economically dependent on the tobacco industry. So it's very important for us to try to find solutions that integrate environment with the social and economic things. That's why the Minister of Environment and Climate Change, in our role of formulating and implementing public policies regarding preservation, conservation, and then sustainable use of our natural resources, somehow we want to contribute to COP in order to create a little bit a more integrated approach for the environmental protection, public health protection associated with tobacco. So we believe, as an example, we can regulate the tobacco production waste disposal, also implementing regulations on disposal of the cigarette butts and electronic smoking device. We are just finishing a decree on reverse logistic of plastic, which that's how we call our EPR, our extended product responsibility. So somehow we are gonna deal with this. We are also related to environmental and health campaigns that can promote these initiatives associated with the risk of smoking. Brazil has already reduced a lot the use of smoke, but we know that there's still a lot of people that do. We also want to encourage some smoke-free areas, especially in environmental protected areas, parks, beaches, urban areas. Also promoting sustainable alternatives, encouraging research, development of more sustainable alternatives for tobacco production. And of course, as we have been doing with the support of the Minister of Agriculture, promoting and encouraging more sustainable agriculture practice, working with the farmers on their practice. So tobacco is very important for the government. And this, of course, has been materialized with the reactivation of the National Commission of the Implementation, CONICQ, which we just heard from Vera. And as a member of CONICQ, the Minister of Environment is trying to engage and dialogue much further with the Minister of Agriculture, Agrarian Development, and especially Public Health. One of example for us now is also a reverse logistic regarding the disposal of electronic smoking devices. We believe, and we are trying to find a way so that we can include this in the national policies of our reverse logistic systems. And we aim to lead this debate, these discussions on the health environment agenda, COP10. So that's why we have been focused on including the topic in the conference agenda to approve the draft decision on Article 18. I also join a lot to the discussions on the international treaties for plastic pollution. I went to INC2 in Paris, INC3 in Nairobi, and we also heard from the presentations that the plastic pollution has getting so much attention from everybody. If we continue like we are doing now, we're going to have more plastic than fishes in our oceans. We all eat between 1 or 2 credit cards of plastic every year. So we have to find a solution. And Brazil really wants to have a legally binding international treaty that can establish a framework for addressing the entire life cycle of plastics, from production, which Brazil is also a big producer, to the correct disposal, recycling, reuse, and other circular economy. And tobacco products, especially the cigarettes, as you all know and we heard, contain a lot of components. Plastic is in the cigarette packs, how they wrap the cigarettes, also the internal and the external package on the cigarettes, but mainly and more important, the cigarette filters that are often made of cellulose acetate. I tell you that when I heard this for the first time, when I joined the government, I couldn't believe it. I said, what, a cigarette filter is made of plastic? It sounds like really strange, but well, unfortunately, that's the reality. So we believe that the environmental tobacco control policy can really contribute to a lot of things that we debated, also climate change, as we heard before. But in our case, especially to the reduction of the use of natural resources in the tobacco production, land, water, energy, prevent deforestation. We are just creating our national strategy for circular economy, and we want to get into agricultural products more and more. So Brazil is confident, and COP10, we take an important step on approving the decision on the Article 18. So would also like to thank my colleagues from Panama and Ecuador for supporting our proposal, and we really hope that these topics could be debated as soon as possible. Thank you
so much, Adalberto, for your presentation and for bringing something also very important, which is this national coherence, the importance for various ministries to work in collaboration. You mentioned working with the Agricultural Ministry, with CONICQ, with Health. Because I've noted from the global report on FCTC implementation, the first the biggest obstacle is industry interference. The second one is lack of all of government coordination. So it's wonderful that Brazil is not only taking a leadership on Article 18 and the environmental impact, but also engaging its whole of government in FCTC work. Our next speaker is Carroll Muffett, who's the CEO of the Center for International Law, and Center for International Environmental Law, and he will present the views from the environmental perspective on the links between the FCTC and the plastic treaty. Carroll, the floor is yours.
Thank you so much for this opportunity to speak with all of you on the vital role the public health community can and must play in the ongoing negotiations towards a binding and ambitious global plastic treaty, and on the unique importance of the tobacco control community to those negotiations. What I'd like to do is put the conversation that we've had about the impacts of tobacco in the larger context of plastic pollution and global health related to plastic impact. In recent years, the world has awoken to the widespread and rapidly growing environmental impacts of plastic pollution, including, as you've heard, on our global climate. Yet the profound impacts of plastic pollution for human health, for global public health, have received far less attention and even less action. The ongoing negotiations of the Global Plastic Treaty create both a unique opportunity and the urgent necessity to close the gaps, both on awareness and critically on action. Accordingly, they create the vital need for the public health community to engage actively in both the negotiations and the growing public discourse on the life cycle impacts of plastics and appropriate responses to those impacts. The plastic pollution that first garnered headlines and drove documentaries was the plastic waste plainly and painfully visible on oceans, coastlines, waterways around the world, including the cigarette butts that are not only a deceptive marketing tool for tobacco, but the single most prevalent plastic waste found in our environment, a vector for carrying poisons into that environment, and a direct source of plastic inhalation for smokers themselves. But that pollution has another more insidious dimension when it comes to human health. The public health community has worked for decades to better understand, trace, and reduce toxic exposures and their impacts. Decades of evidence have shown that plastic products carry an array of known or potentially hazardous substances. In recent years, evidence has mounted that these exposures are more pervasive, more persistent, and more pernicious than previously realized. As all plastic produced and used continually sheds microscopic fibers, particles, and dust, contamination by tiny plastic particles, micro and nanoplastics is becoming pervasive in the global environment. Microplastics rain from the sky on remote mountaintops, contaminate urban areas, and pristine high-altitude lakes alike. They are omnipresent in homes, offices, laboratories, in the room where I'm sitting now, and in the one where you're sitting. They are in the air we breathe and in the breaths we take. No one is immune. A study of inhaled and exhaled breaths for 30 volunteers in China last year found microplastics in every sample, every single sample. The smallest particles will be carried deep into our lungs. In 2022, researchers found microplastics were in 85% of lung tissues they sampled. They identified a dozen different plastic polymers, polypropylene, polyethylene, PET, resins. A more recent 2023 study found significantly higher concentrations of these microplastics in the lower respiratory tracts of smokers compared to non-smokers, adding to the litany of harms smoking inflicts upon individuals and upon society. We ingest another million particles of plastics a year from the airborne plastics that rain onto our food and food service items, where they join still more plastics we ingest from sources too numerous to count. Microplastic particles are found in drinking water from around the world, including both public water sources and bottled waters. They're found in agricultural soils and food crops grown in those soils. And here I say is another interconnection between the fight within the FCTC and the Global Plastic Treaty, because one of the growing sources of microplastic deposition in those soils is the use of microplastics and nanoplastics to encapsulate pesticides and fertilizers on tobacco and other crops. Microplastics are found in fish and shellfish that provide livelihoods and vital nutrition for populations around the world. A study released just this month found microplastic contamination in fully 90% of proteins sampled: beef, pork, chicken, fish, shellfish, plant-based proteins, tofu. And just as these plastics are found in our lungs, they are also found in the human digestive tract, in our blood, in our cells, in amniotic fluids. But while plastic pollution is pervasive, it is not natural. All of it, every particle, is human-made. This fact both magnifies and compounds its impacts on human health and points the way toward dramatically reducing those impacts. The plastic particles carried into our bodies and our food, air, and water are Trojan horses. More than 10,000 chemicals have been identified in plastic production. Of these, 2,400 meet one or more of the EU's criteria for persistence, bioaccumulation, or toxicity, including hormone disruptors, potent neurotoxins, and a wide array of carcinogens. For the remaining 7,600 substances, their toxicity has largely not been assessed or publicly disclosed. Yet these substances can readily leach out of plastics and into human bodies. Plastics are a vector for other toxins they readily absorb from the environment, including heavy metals, persistent organic pollutants, and polycyclic aromatic hydrocarbons. A review study last fall found that these exposures to plastics and the toxins they carry with them cause a range of adverse health effects across an array of organ systems, from oxidative stress and inflammatory response to reproductive toxicity and genotoxicity. In the language of public health, the plastic contamination in our bodies is not a single insult, but many, some known, most unknown, all continuously interacting with each other, with our bodies, with our hormones, and with our genomes. As a result, we are in the midst of a population-scale human experiment on the effects of pervasive plastic pollution and chemical contamination on the human body, both within and across generations. Every one of us, each new baby born, each one conceived, we are all test subjects. But for those living where plastics are mined, made, discarded, incinerated, the tests have been more sustained and more acute, and the results are clear. The production, transport, use, disposal, and environmental leakage of plastics pose profound risks for human health across the entire plastic life cycle. These are risks with which the global public health community has long experience, relevant missions, and unique expertise. Extracting the fossil fuels from which plastics are made releases toxic and hazardous pollutants into the air sheds and fresh water supplies where oil, gas, and coal are produced. Spills of plastic feedstocks and precursors from pipelines and transport corridors expose unsuspecting, unprepared, and largely unprotected civilian populations to sometimes catastrophic chemical and toxic risks. And nowhere are these risks more pervasive, more sustained, or more severe than in the frontline and fence line communities where fossil fuel feedstocks are converted into plastics and plastic additives. These communities are consistently exposed to high levels of hazardous air and water pollutants and frequent accidental or unplanned releases of toxins into their environment. As a result, in communities around the world where plastics and petrochemicals are produced, documented health outcomes are consistently poorer than in equivalent communities without those industries. These communities experience high rates of asthma, bronchial diseases, neurological and developmental impacts, and cancers of many kinds. Critically, toxic releases continue long after the useful economic lives of the plastics themselves, lifetimes that are too often measured in moments, minutes, or at best months. The vast majority of plastic waste ends up accumulating in landfills where toxic fires threaten the lives and health of waste pickers. It's burned in incinerators, releasing toxic ash and gases into the surrounding communities, or it's released into the environment as with cigarette filters, where it creates an array of additional human health hazards. Even the roughly 5% of plastics currently being recycled contribute to these toxic releases, both through the recycling processes themselves and through the perpetuation and concentration of chemical risks in recycled products. If plastic production, use, and disposal continue growing on their current trajectory, the human health impacts of the plastic crisis will grow along with them. But because plastics are human-made, we have other, better choices. We can choose a different path. We must stop the growth in plastic production, quickly eliminate the least necessary and most harmful plastics, including cigarette filters, and phase out virgin plastic production over time. We must ensure that plastic production is safer for everyone, beginning with the frontline and fence line communities where plastics are made. This means stronger human health and human rights controls over all plastic production. In order to be truly reusable and truly circular, plastic products that remain in the economy must be safe. This demands that plastics be free of toxins that would make them unsafe to reuse or recycle. And this in turn demands that governments require greater transparency and disclosure about the chemicals that are in plastics. It demands a treaty that places the protection of public health over the protection of business secrets. And it requires eliminating false solutions like incineration that purport to address plastic pollution by simply turning it into air and water pollution. The Global Plastics Treaty must be comprehensive. It must be ambitious. It must be binding. And it must be safe for everyone, not just for some. And for all of these reasons, it needs the voices, the vision, mission, mandates, and expertise of the global public health community, this community. Like the WHO Constitution itself, the Framework Convention on Tobacco Control explicitly embeds the recognition and protection of human rights in its objectives and its principles, beginning with the human right to the highest attainable standard of health. It recognizes the responsibility of states to consider and address disparate impacts on the most vulnerable populations. Together, the parties to the FCTC have recognized and confronted the role of industry influence in vital global public health concerns. They've acknowledged that you cannot address the harms from a highly traded substance without addressing the trade itself. They've confronted the multifaceted health, social, economic, and environmental dimensions of a shared challenge. And critically, they have enshrined and protected the power to vote on challenging issues to ensure that global progress can't be constrained by obstruction from a single reluctant state. For all of these reasons, these negotiations need you. They need all of us together. Thank you.
Thank you, Carol. And thank you for this message, definitely of need for collaboration, coherence, and working together to achieve those environmental and health objectives. And we'll go back to the questions. I'm cautious of time because we'll have plenty of time for Q&A. I'm just going to quickly, before we go to the Q&A session, I'm going to give the floor to my colleague Laura Salgado with the Global Governance for Tobacco Control. We'll just very, very briefly introduce the audience of a global alliance called the Stop Tobacco Pollution Alliance that's been working on the tobacco treaty and trying to bridge those two communities. And then we'll go straight to the Q&A. Laura, the floor is yours.
Thank you, Laurent. It's really an honor to be part of the discussion today and to talk about something that I am passionate about. We are engaging in the UN Plastic Treaty because we believe this is a unique opportunity to address plastic problems and tobacco control at the same time. Next, please. The Stop Tobacco Pollution Alliance is a young but effective and powerful movement. As of today, the STPA is about 100 organizations that are unified position aligned with the FCTC. The STPA members are committed to help raise awareness about tobacco toxic plastics, are ready to call for ban on cigarette filters, and will ensure that the tobacco industry is excluded as partner in the environment policy. STPA has expertise that we bring to the negotiations. With GGTC technical assistance and consultation with experts, the movement has published policy papers, briefing materials to inform about the campaign and to ensure coherence between the FCTC and the Plastic Treaty. FTPA members have attended and support the negotiation process, have delivered key messages in various platforms, including through joint statement with environmental groups. During the intercession period, FTPA members advocate corporate accountability, submitting position papers and made presentation upon request of the INC Secretariat. Some members took the opportunity to submit their position to ministries, health and environment in preparation for INCs. Next, please. The movement had been heard at the negotiations, and as a result, the FCTC had been highlighted during the debates. There is an increased support for immediate ban on cigarette filters and for having a conflict of interest policy in place. GGTC, along with our partners at ASH, will continue to serve convenient of the STPA, and is very important for tobacco control and public health community to take action on plastics, whether at global or national level. It is crucial to continue to strengthen our engagement with the environment sector because policies that deals with plastic pollution are being shaped as we speak, and these policies can support or undermine our empowered strategies. So if you are looking for an opportunity to have an impact and make a difference this year, join in the action of the STPA. Visit the website, join the listserv for updates, join the lines to build a capacity building and work with your government in both sectors, health and environment. Join our campaign, follow our social media, and please help us by sharing content. We celebrate the draft decision of the FCTC Article 18 presented by Brazil and will support its implementation. Thank you, Laurent.
Thank you, Laura. So we'll go straight to the Q&A session. Feel free to continue to type them in the Q&A box. And I see several themes that are appearing from the questions that I'm receiving. So I'll start with one of the first one is that came up is, what if, what are the dangers, the potential dangers with the industry if we ban cigarette filters of going towards a recyclable product and use that as a marketing tool and a greenwashing tool? And also, so if you could have some of the panelists address that first question, then we'll go. Another thing that is going to come up is the conflict of interest, so we'll move to that next. But the first one is on how do we ensure that the industry does not use any of that to its advantage? Tom, you want to get started maybe, and some of the other speakers.
Yes, thank you very much. There's already been several attempts at developing, marketing, advertising biodegradable recycling or other kinds of answers to the non-biodegradable plastic filter. I think the important thing is that any filter is not going to do any good as far as a health intervention. I think that's something we just have to say, look, the filter is there to sell cigarettes. It is a marketing tool. That's what it's been throughout its history. A biodegradable filter means that they're still going to be used to market cigarettes as a, quote, safety feature, even though they don't provide any safety. And what'll happen is that it'll allow smokers to be less conscious about disposing of their cigarettes. When it's biodegradable, oh, we can do that easily. Just, it's much safer than disposing of the other kinds of cigarettes. So I think it'll have an adverse effect. The other thing is that in addition to the plastic pollution, we all know now that there's extensive chemical pollution as a result of discarded cigarettes. Cancer-causing drugs, or cancer-causing chemicals, as well as heavy metals, and nicotine in itself is a toxic hazardous waste chemical. So that those will continue to be leached into the environment, whether the filter is biodegradable or not. So there's no advantage to this, in terms of environmental contamination. But I think the important thing is that this is another example of whether it's the industry or, partners who decide to join the industry in trying to sustain tobacco use, trying to divert attention from the environmental consequences that deposition of trillions of cigarettes into the environment have. And that it is yet another downstream approach to the problem, not an upstream approach where the prevention of the tobacco product waste by virtue of eliminating filters as an attachment to cigarettes will have a much more important effect. So I think it's just something that should be discouraged, tamped down right from the beginning, and not allowed to be a serious consideration throughout these discussions.
Thanks. Do any of the other panelists would like to add to this specific?
Sure. Oh.
Yeah, I see Carroll.
Go ahead, Carroll.
Carroll, you go first, then Kritika.
I think there are a couple of points that I would make. First is we have seen this appeal to recycling and recyclability over and over again as a false solution to the plastics crisis. And we know that recycling doesn't work, but it is self-evident that if the producers of cigarettes can't keep people from throwing up to 65% of filters onto the ground in the first place, the odds of those filters making it into any recycling system are vanishingly small. Even beyond that, on the question of biodegradability, I think there is more work to be done here to expose those conflicts of interest that we've been talking about. In prepping for this call today, I was looking at biodegradability research on the cellulosic acetate that is the primary component of cigarette filters. And I found that one of the leading pieces of recent research was actually co-authored by scientists at a major academic institution in collaboration with the company that produces that cellulosic acetate. What's remarkable is, despite the fact that this was a joint venture, the scientists did not acknowledge any financial conflict of interest in the paper. And within 4 months of its publication, one of those scientists had actually gone to work for the chemical company. I think we have an ongoing duty to expose this deep conflict of interest that is often intertangled with denial and false solutions and greenwashing efforts.
I think it's also important to realize, excuse me, that the filter, again, it's a plastic product, is not manufactured by the tobacco company. It's manufactured by plastics companies. Celanese, Dow has made them in the past, Eastman. And so there's an opportunity for the tobacco industry, which is so good at hiding behind others, to actually hide behind these industries when it comes to the resistance that's going to be mobilized to resist their elimination as a plastics product additives to cigarettes.
Kritika, do you wanted to add something to that?
Yeah, just very quickly, and I'll also in the chat try to share with everyone. So there is a PMI report which they've done on how they should reduce post-consumer waste, and they've talked about behavior change and biodegradable filters and whatnot. So just to add to what Carol's point was, that I think it's very important to highlight to member states that these are the efforts that the tobacco industry is going to come with you. One is going to be these biodegradable filters, and then with the newer products, they're going to try giving you these paper bags to say, oh, you know what, this increases recyclability. So it's also from WHO, from the Secretariat of the FCTC, and from the CSOs that are online to preempt these moves. The industry is already making them. But in the context of the plastics treaty, there are going to be provisions with respect to design for circularity, and we have to ensure that nothing tobacco products comes in that. We have to ensure that not the other provisions are used to the advantage of the industry. And there's another term which is used in the terms of the plastics treaty, which is regrettable substitution. So if you talk about biodegradable filters, sure, what do we know? What are the health effects of these biodegradable filters? So yeah, I'll stop with that. Thanks.
Very wonderful points. So I want to follow up now on one of the major themes on we have a lot of questions. We will not be able to get through all of them. But one of the themes that comes up, and it came up through not just Carroll, through the undisclosed corporate conflict of interest, for example, in that session that you mentioned. So how do we, and in the context of the Framework Convention on Tobacco Control, even despite having an article that addresses the conflict of interest, country after country during the COP negotiation on the first day mentioned that the biggest obstacle to implementation is corporate conflict of interest. And it's also in the report that is being submitted to the COP for the negotiations that will start in a couple of weeks, in about 10 days. That again, tobacco industry is the main industry interference, the main obstacle. So now, as we negotiate in this plastics treaty, we've seen with the Framework Convention on Climate Change, which I understand for the first time mandated corporate disclosure for the delegates, and it was overrepresented by the fossil fuel industry. I understand it was over 50% of the participants represented industries that had corporate conflicts of interest. So how do we work together with the tobacco control community and the environmental community to ensure that the plastic treaty, for example, has adequate conflict of interest measures within it? And what would be the most useful to the environmental community from the tobacco control community? And how can we best work together on that very, very important element of the treaty negotiations? Who would like to venture? Was my question clear? How do we, and a few people have asked, will there be a conflict of interest article or measure within the plastic treaty? I know I've heard, unfortunately, I couldn't attend some of the negotiations because of health issues, but going to the debrief sessions, I hear everyone asking time after time, saying that we need to address corporate conflict of interest. Carroll, go ahead first.
I think this is an example of why the tobacco control community is so critically important in the global plastic treaty negotiations, because I think that we need to learn the lessons in the global plastic treaty negotiations that have been already applied and developed in the Framework Convention. I think you're right. We need transparency and disclosure of financial interests. In the last Nairobi round of treaty negotiations, CL analyzed the number of industry representatives that were there, and it far exceeded the delegations of all but the largest states. And I think this sort of disclosure of interest is where we begin, But the question is, how do we move beyond simply the disclosure of interest to control the influence of companies who often show up not only in their own names and, you know, under the guise of AstroTurf institutions, but on national governmental delegations. And I'll say that we recognize that challenge. We have a long way to go. And I think this is a place where the tobacco control community has many lessons to teach us.
Yeah. And it's both it's protecting the development of the treaty and also its implementation at national level from corporate conflict of interest. Kritika, I mean.
So the optimist in me, obviously, I alluded to some of this in my presentation, that yes, of course, the FCTC is a great example for the plastics treaty to emulate. But in all the three sessions, there's been discussion on, you know, how civil society has probably not got enough room in the negotiations, how this should be protected. But my understanding in interacting with colleagues from UNEP is also that, like I said, it's a heterogeneous industry. With tobacco, it becomes very clear this is the tobacco industry and we want to exclude them. While in the plastics treaty, you need some of them for the implementation of the treaty, which then boils down to how do you identify people who you need and who you want to exclude, which is where the sort of complexity in the plastics treaty lies. But it is, as you said, it is very important given how much science is required and will be underpinning this treaty as well. For those that who are not needed, the oil and gas industry, who can dilute these provisions should be excluded from this. And definitely Article 5.3, WHO's framework on non-engagement with non-state actors, or the FENSA, are good models to look at.
Thank you. My next question is for our Brazilian representatives from Vera and Adalberto. How can we support this very, very important decision? And we're so happy that this decision is present, as civil society, that this decision is presented to the COP. And how do you see it can then help with the plastic treaty negotiations? And what can we do to support?
I'm going to start and then I'm going to hand over to Adalberto. I think that this is about a construction, in fact. You know, I think that we need the support from the civil society, not only from the point of view of supporting during COP10 this discussion, but also just to keep informing, sharing, discussing the issue, and also in the sense of informing governments and informing parties on the several aspects, on the several findings, and the developments, updates in regard to this topic. I think that this discussion of filters and ban on filters is something that is pretty important, but it's something that needs some point of maturation, let's say. So the more we discuss this, the more we collect information, we gather evidences, the best we are going to be prepared for a potential ban. And at the same time, the better we are going to support governments in terms of what they can do in terms of addressing this plastic pollution. I think that the same goes without saying to getting into the discussion of the plastic treaty. We need more governments apart from Palau and Panama, just bringing this issue forward in the plastic negotiation. And I'm sure Adalberto is already preparing to do it soon. He is the head of the Brazilian delegation and the INCs of the plastic treaty. So and the more Adalberto gets has information, the better he's going to be prepared to find out the opportunities to address the issue. But I just going back to the question before, the tobacco industry, while we have a good example in the framework convention on tobacco control, the tobacco industry is forcing a lot governments, COPs, and etc., to have a seat in the discussion. And they are coming up with issue of democracy, and they are using the other negotiations and the other treaties to say, see, in the climate change discussions, we can have a seat. In the plastic treaty discussions, everybody can participate. The petrol industry can participate. So why is this going on with the COP discussion? So we have even to be aware that while we have a very good example, we have to keep it, because if we leave it the doors partially open, the tobacco industry will just will go for it. So that's it.
Indeed, we've seen them try to take advantage of any potential platform. Adalberto, do you have anything we'd like to add? And thank you for being the champion and in the negotiations on the plastic treaty. But please go ahead.
Yes, well, I think I agree a lot with Vera. Brazil now has been trying to implement public policies based on science, based on data, based on studies, you know. And there's a lot of areas that we know are very sensible or very difficult, but the problems and you know, the external negative impacts of these problems are out there. So we gotta try to do something. Regarding plastic, in the case of Brazil, Brazil wants a legally binding agreement that can reduce. Cigarette filters are one of the top polluters of ocean. We are having a lot of issues all over Brazil. So we need to find a solution. We need to debate it. And in my opinion, civil society can help it as we grow up with a governance structure. So first, as Vera said, we need data, we need information, you know, we need to have good studies that we can prove the points where why we are doing something, why we are moving some agendas. This is also a goal of our Minister Marina Silva. She wants us to be very transparent on everything we do. So if we do something, we have to tell people why we are doing, what information and studies subsidize us to move in that direction. So I think that civil society has this role also of increasing the debate on the topics, because if society doesn't know that these are problems, are very difficult for us to implement these measures, because when we try to move these agendas, of course, you know, the forces that are against it tend to be very strong too. So I think governance, transparency, and data, this is what we need.
Thank you. Thank you so much. So I want to thank all the panelists and all of the attendees also for joining us today. I've seen a lot of questions, more questions also on how the conflict of interest process, the Article 5.3 was included in the FCTC. We will be hosting a webinar on that topic, just exclusively on that topic. So we will be able to address that in much more depth. We will probably do this after the Framework Convention on Tobacco Control COP, which is held in Panama, but my colleagues and Laura Salgado, who's one of the panelists, will help with this, with the development of this webinar ahead of INC4. So stay tuned for that. Make sure that you sign on to the listservs that we have in order to receive information about those webinars. And also pointed out here, like we have some, to address tobacco industry interference. Well, one of the things we try to see is to monitor who gets money from the tobacco industry in the countries of lobbyists. And for the United States, at least one of my colleagues, Nichelle Gray, has put together a very, very good tracker on lobbyists and lobbying firms registrations, which gives you a very good idea of how the industry is using any platform it can to lobby for its interests. So again, thank you very much for joining us today for this 1.5-hour webinar. And we'll be having more of those to address the interconnection between the Framework Convention on Tobacco Control, the UN plastic treaties, but also other environmental treaties given the high impact of the tobacco industry on environmental goals and objectives, and the impact it has on deforestation, carbon emissions, and so on and so forth. So again, thank you so much for joining us today, and